relates to the ban at the moment, or the deferral, I should say, the deferral period that currently applies relating to men who have sex with men donating blood and tissue, is that something that you can answer, or is it a better one for me to refer to another?
No.
Therapeutic goods.
Yeah, it's TGA, so it's okay.
Okay,
So
sure.
far away.
Yep.
Sure. Look, can I ask whether you're reviewing that at the moment? I understand the Australian Red Cross Blood Service and the Kirby Institute have recommended reducing the deferral period that applies from 12 months to 6. Is that something that is being reviewed currently?
Senator John Skerritt, Deputy Secretary Regulatory Services, including responsibility for the TGA. It is not something currently under active review. We completed an extensive review a couple of years ago in collaboration with the Australian Red Cross Blood Service and at their request. And we looked at a range of factors, including reports from the Kirby Institute, including the expert panel review that the Blood Service commissioned. Our decisions about blood donation are based purely on risk-benefit for the blood supply. Benefit measured in terms of quantity of supply, risk in terms of any potential risk of blood that may be contaminated. I do want to clarify one thing, however, because it has been misrepresented in the media. Our therapeutic goods regulation, the infectious disease order, actually establishes a deferral period for donation of blood, and I'll quote, from a donor whose sexual practices put them at increased risk of acquiring infectious diseases that can be transmitted by blood cells or tissues. So it is not a TGA's role to specify particular groups in the population. It is actually the Red Cross Blood Service's role who determines and therefore decides to defer donors but have an increased risk based on their sexual behaviours. However, what we did say after the decision was made not to change the deferral period was that we would be very happy to consider any new evidence. And I discussed that with the CEO of the Red Cross Blood Service as recently as the end of October. There's no new evidence now, but she feels in a little while more they'll have some more substantial evidence and want to come back with further data.
In terms of access to new evidence, has things like access to the new medication PrEP or rapid HIV testing within some state jurisdictions, has that been taken into account in the deliberations of the TGA?
Firstly, on to PrEP. As you're well aware, PrEP is not yet a registered medicine in Australia.
Yes.
There are some clinical studies of PrEP underway in various states to actually get a good handle on the percentage reduction in transmission. There have been various numbers quoting between 90%, which would still leave 10%, obviously, out, to 94%. And so the large trials in New South Wales and Victoria, one of the things they're trying to establish is actually whether we are closer to 100 or closer to 90.
It has had good results overseas, hasn't it?
PrEP has had reasonably successful results overseas. One of the challenges with PrEP, which is a factor being considered in its evaluation, as it is for any drug, is the fact that this is a drug now being given to a group of healthy people as opposed to a drug being used for the treatment of people who are infected with the HIV virus.
Sure.
And so your risk-benefit changes when you give a drug to healthy people as opposed to people who are sick with the disease.
Sure. I might just seek the guidance of the Chair. I do have a few more questions about PrEP. Are you happy for me to proceed with those? And then that'll finish me. Okay. Just while we're on the matter of PrEP, you might be aware that in November of last year the Senate passed a motion calling on the government to look at regulatory barriers for access to PrEP and rapid HIV tests and home self-tests. I'm interested to know from the TGA, I'm sorry, I can't see your name there, sir.
John Skerritt.
Mr. Skerritt, keen to hear from you about what investigation is happening in terms of availability of PrEP, but also keen to hear from the Minister about what action that the federal government has taken since the passage of the motion in the Senate last year.
Would you like me to go first or you first, Minister?
That's fine. No, I'll go first. Thanks, Senator. Look, I'm not allowed to take that on notice for you.
Yeah, that's
But
fine.
I'm very happy to do that to the Minister, and I'll pass to the Professor.
Thank you. Appreciate that.
Senator, on the 7th of July 2014, so 18 months ago, the government made an announcement that they would change the regulatory requirements. So until that date, it was self-tests for HIV were not permitted in Australia. After that date, they have been permitted, but obviously there has to be an application for a product. The product has to be reviewed and then approved. I can't disclose whether or not we've received applications and how many. It's a convention, but for commercial reasons we don't do that.
That's fine.
I can comment, however, that there's 3 tests that are available for point-of-care testing. Now, that's separate from self-testing. That's point-of-care
Yes.
testing. And these have been used quite widely. In fact, New South Wales Health worked together with the Mardi Gras organisers to organise a significant program of point-of-care testing with a healthcare professional there to help interpret the tests. You asked before whether the blood supply issues were related to the availability of point-of-care testing. Point-of-care testing is tremendous because it increases the access of a wider population. It does, however, have one significant disadvantage over laboratory tests, and that's that it picks up antibodies to the virus, and in the first 3 months, it depends on the individual, you are virally infected, but you don't have antibodies. There's a process known as seroconversion that occurs. And so in the first 3 months after an infection, you can still transmit that infection, but you can come up falsely as negative in one of these point-of-care tests. And this is again one of the factors that has to be considered in looking at a range of factors, including blood donor withholding periods.
Sure.
On to the other issue with PrEP.
Yes.
As the company has announced, PrEP is under active consideration by us. We only received an application middle of last year for PrEP. The company could have put the application in a decade earlier when similar approaches were made to regulators overseas. But they've made a series of commercial decisions related to the timing and their Australian market strategy. We can't force a company to put in an application for a medicine at any one
I
time.
realise that, but do you have a deadline that you're working towards in terms of the availability of PrEP in Australia?
We are hoping, we originally had a deadline of March this year.
Yes.
However, we did not receive information back from the company in time to meet that deadline. Our deadline is now May this year. I am hopeful that the product will be considered, and normally we don't talk about applications, but the company has gone very public on this one.
Yes.
So I'm not breaching any commercial confidentiality. They're happy for us to talk about it.
Sure.
So we're hoping that it will be considered by our advisory committee at the very beginning of April, and a decision made soon after.
Sure. Thank you. Just 2 more questions on this. Again, in relation to PrEP, there were some media reports late last year around overseas orders of PrEP being made or being held up by Australian Border Force officials. So it's my understanding that people can get access to PrEP in Australia, but only on the advice of a doctor, and they pay slightly more for the availability of the medication if they order it overseas. That's your understanding?
We've administered what's known as a personal importation scheme
Yes.
for many years. An individual with an Australian doctor's prescription can import up to 3 months' supply of medicine for them. You would need to obviously check with the Australian Border Force for reasons for any issues that importers had with them. There was some consultation with us because my understanding is that some of them had consolidated shipments, and so when it arrived at Sydney Airport, it wasn't medicine for one individual. In order to save on shipping charges, it might have been medicine for 12 people, and therefore it looked like a commercial shipment rather than an individual one. But the specific details of the hold-ups, really you'd need to refer to ABF.
That's fine. Are you concerned about the health implications of a hold-up like that in terms of people that might be relying on that medication?
I can't comment on Australian Border Force processes. Surely if they believe that something is being imported or may be being imported for commercial reasons, they have a right to consult and check with others.
But theoretically, it could pose a risk to people, couldn't it, if people are waiting for that medication and it's being held up?
Well, again, there's an individual issue here, whether people followed the TGA's processes of making it quite clear that it was personal importation from one individual. I'm not privy to any details on the shipments other than that there was evidence that there were, consolidation.
Right.
And it was unclear whether it was therefore one individual importing material for themselves.
That's fine. And one final question. Are you aware of any PrEP trials scheduled for South Australia? Any work that's being done in the state of South Australia in that regard, or with provision of rapid testing? I don't think the state government have anything in place.
On PrEP, I'm not aware. I mean, colleagues may be. I mainly have heard about the large trials underway in New South Wales and Victoria, and a smaller trial that had been announced by Minister Dick in Queensland.
Yes.
That's not to say that individual hospitals in other states are not organising their own trials.
Sure. Could you take the questions about South Australia on notice?
I will.
Thank you.